It has been estimated that up to 80% of people will suffer a problem with their spine that causes significant pain. This means most people will be visiting their GP at some point in their life because of some pain they are suffering with, which is directly related to a problem with their spine. And yet, despite the high number of people that are suffering, satisfaction with the outcome of their doctor's visit is at an all-time low. And this is usually after a painful and prolonged wait list, just to get in to see their GP. The initial steps to deal with the pain that you're suffering with is to give you some painkillers or anti-inflammatories. And while there is a chance that these might help reduce the symptoms, I think most people know by now that drug therapy does nothing to deal with the physical cause of the pain, and also come with side effects that can sometimes be serious. If you're lucky, after you've been disappointed by the lack of progress with the drug approach, you may be sent for a battery of diagnostic tests. These tests range from simply bending forwards or a bit of a poke and a prod, if your doctor touches you at all, to blood tests, stool samples, MRIs, CT scans, visits to consultants of various kinds, and so on and so forth. But frustratingly, after a long drawn-out process and a number of tests, you are left with a diagnosis and no progress in your general condition, or worse still, a pronouncement that there's nothing wrong with you. But you know something isn't right because you're still suffering. This is because of the approach taken by the traditional healthcare system, which never addresses the needs of the body. Painkillers, after all, have zero effect on the causes of spinal problems. They merely serve to mask the symptoms. As clinicians, it's easy to worship the diagnosis whilst ignoring the cure. I've been there myself. Over the years, I've taken and read thousands of computer-analyzed X-rays, scans, etc., but I have learned that they have very little effect on the outcome patients are experiencing. It's disappointing. I devoted the last 19 years to first-class diagnostics. In a top clinic, and although we helped a lot of people with our regenerative therapy, I have wasted thousands of hours going over diagnostic tests with a fine-tooth comb, when in reality, there is a much less time-consuming but more accurate way of determining the best approach to regenerative treatment. The reason the best diagnostic tests are kind of a waste of time is that the body already has an amazing system for detecting problems, and it's much more precise than an MRI, CT scan, X-ray, thermograph, or electromyograph. It's called the nerve system, and everyone has one. It will tell you where to direct regenerative therapy exactly where it is needed. You just need to know how to speak the language of the nerve system, and the trouble causing your pain will reveal itself. Think about it. If you touch something hot, don't you immediately know where it is? Even if it's in an area of skin that doesn't have the discrimination of your fingertips, it's still usually super easy to pinpoint exactly where the pain is. It's almost like it's supersensory. And yet, instead of listening to you, where do the typical healthcare practitioners look? At MRIs, which they often can't even read, CT scans, which expose you to an enormous amount of potentially harmful radiation to provide you an almost worthless diagnostic test. Blood samples, stool sample, forward bends, where does the madness end? They certainly don't look at your supersensory system. Think about this. When you're having an MRI, for example, 99% of MRIs have you lying on your back. It's a completely non-functional and static test. No wonder so many people who have had MRIs have been told they are normal. There's nothing wrong with you. In contrast, your nerve system is telling you how your body is doing all of the time in every position, and when you are doing active stuff too. When we are testing your nerve system functionally, we can adopt any active position or functional movement and test you right there at that critical point when your problem shows up. I've got a lot of experience with this, and so has my partner. I have never seen anything as effective as testing the nerve system to help you get the results you deserve. Let us help you too, by unlocking what your supersensory system already knows about why you're suffering the way you are suffering. Get off the diagnostic, merry-go-round now, and do something that really can help you get better, long term. Once your nerve system has shown us where we need to work, we use the most advanced regenerative therapy tools available today. This means we can lower your pain, lower your neurological and physical stress, rejuvenate and regenerate your injured tissues. You can have more than mere pain relief. You can enjoy long-term improvements and a stronger, more resilient body.